Well, hi there. It's good to see you right here on Health Diary. My name is Winnie Lubembe, and today we're coming to you from the Aga Khan University. Now, on the show today, we'll be focusing on holistic approach to cancer care, because majority of the times when we think about cancer care, we think chemotherapy, radiotherapy, or surgery. But then what happens to a patient's, say, state of mind or mental health? What happens to their holistic approach as far as either perception or reception to the news? Well, that is what holistic approach to cancer care is all about. But hey, we'll find out more of that after this fact of the matter. When it comes to cancer care, medical treatments like chemotherapy, radiotherapy, and surgery are proven to fight the disease, but their side effects can be hard to live with. Therefore, a holistic treatment may help ease some of those problems and improve the general well-being of a patient. All right, so Zahra, when we think about cancer care, I think chemo, radio, and all those things. But now you're introducing something different. Yes. That is holistic approach to cancer care. So what exactly does that either look like? What does that mean? Yeah.
So when we look at holistic approaches, that's when we look at a patient as a whole. So we look at how the mind, body, spirit, and even social environments play an impact on one's journey. And AKU has been moving towards holistic approaches in cancer care, sort of creating a comprehensive treatment plan. So we're not only focusing on the conventional side, but we're also now looking at the psychosocial factors that can affect one's journey. And part of that has been implementing a distress screening program, which is now standard of care, where we look at how one's physical domain, social, spiritual, and emotional domains has been affected by the diagnosis and how that affects their quality of life. With the screening comes with the clinical assessment, followed by 2 pro bono counseling sessions, and now new holistic modalities like Tai Chi or EFT, chair yoga, that just is supposed to work parallel or complement the conventional side of treatment.
Okay. And this is fairly new. You're the first ones to sort of like introduce that into the market?
Yes.
Yeah.
Yes.
So how does that look so far? What are people, how people responding to? What are they saying?
Yes. Yeah. So in the beginning, there was a lot of pushback. Simply because there's a stigma that's associated with cancer, and then now you're adding mental health to that. And like you said, cancer is looked upon as a death sentence. But when we implemented the distress screening program, which is the foundation of psycho-oncology, the holistic approach, it actually changed people's perspective. It reached a point where people were knocking on my door to say, we want to be darted. We want to be asked what is affecting our cancer journey, what's affecting our quality of life. And this is where people started to say they feel heard and validated compared to when they go for the oncology consult.
What exactly do you do, and what does that look like, so that we don't have, a bit of a misunderstanding from people?
So psycho-oncologist, it's a fairly new term. But what that means is I'm a clinical psychologist by profession, trained in mental health, and the oncology comes from the oncology care training that I've received. And that's different from a medical oncologist that went to medical school and treats more the biological aspect, like the disease itself. I treat the human experience that goes along with that, journey.
And talking about human experience, because again, like you said, when we talk about holistic approach, you look at a person as a whole. So what is it that you've seen over time, that you've noticed over time, and especially when it comes to cancer, either the response to treatment or even just receiving that news and what it does to a person and to the body?
So a lot of patients are very, very distressed when they're newly diagnosed. But what we've started to see as we provide this continuous psychosocial care, treatment becomes easier. Their body seems to accept it easier. And we were focusing on breast and prostate cancer patients in a brain resilience study. And what we saw is these individuals that received psychosocial care every 3 months reported less symptoms of chemo. So the only symptom they had was fatigue that was lingering. But things like appetite, loss of appetite, nausea, some were not even reporting that. So there is some added benefit to having that continuous care throughout one's journey. And another thing that I see here that I didn't see in Toronto is how resilient the Kenyan community is. And that is because they are so spiritual. That belief in God is really what keeps them going.
I see. And can we just then talk about the connection between the physical and the mental, aspect of it, and then when we focus on care and what care looks like, at least people understand that connection between mind and body.
Sure. So when we look at the physical aspect, when a patient goes in to see an oncologist, the oncologist just focuses on the treatment, the disease, and how we can cure this person. But there's all these other factors like emotional distress that mimics physical pain. And it's also known as psychosomatic symptoms. And that's where my profession steps in, is to see, is this pain psychosomatic or is it related to a biological or physical component from the treatment from the treatment. Yeah.
And then do you have like guidelines to sort of help you when you're looking at that, and especially when we're talking about psychosomatic?
That's where DART, the distress screening tool, steps in, because what DART does, it looks at the physical symptoms, it looks at spirituality, social factors, financial, and then it looks at depression and anxiety. And it helps us understand also at what range, how severely distresses this person, and what really is affecting them. So for instance, if it's financial, because treatment is very expensive, we have a welfare committee at AKU. So we would gather that information, send it to the welfare committee, and then they take over. All right, and see how they can step in to help this person financially. Say like emotionally or spiritually, do you also have ways of support for that? So for emotional and spiritual, that's where we provide the pro bono sessions. And if a patient still needs more sessions, they can always come back and book a full 60-minute session at a subsidized rate. But then we work together in finding like adaptive coping mechanisms so that they could take those skill sets and use it at home or use it at work, and just learn how to cope with life.
So do we have, say, patients where you would say maybe not this approach, maybe just focus on conventional approach, or is it, say, not available but accessible to everybody, say any cancer patient?
So yes, the holistic, so the DART screening tool, that's for everyone, for patients, caregivers, healthcare professionals too. We also darted the nurses at the department to understand what's their distress levels. And then the modalities that come with it, so the interventions, that has been mostly with the breast cancer support group, because we meet quarterly and we do the workshops at site at the university, where we provide an educational component and then an adaptive fun activity.
For them to participate in. So when you say different distress levels, what does that look like? How, say, do patients either present, that you would look at a patient and say, okay, this one, maybe we focus on this versus the other?
So for distress, we have the 3 ranges where it's mild, moderate, and severe. And DART captures that. But there are times when patients underscore on the DART assessment because they fear being judged for how they're screening, the responses that they're giving, or they believe that they're okay because they're resilient. But that's where we provide the clinical assessment. So the clinical assessment it's somewhat mandatory with the screening.
Okay.
And that's where we evaluate to say, does it validate, does the way they're expressing what they're going through, their facial expressions, their gestures, does that validate what they screened on the tool? And quite a few times you find that it doesn't. The tool is not a true reflection of what they're really going to. So that's how we go about it.
So then what do you do in such instances where, say, your patient is say, presenting this way, but then it's not, you know,
it's not a true reflection. So I provide the clinical assessment, and then with that I provide brief psychosocial care and try to normalize talking about mental health, try to normalize the diagnosis or the side effects of treatment, like loss of hair, losing weight. And once they get comfortable, they eventually then come around and want to be re-darted. Or when they come back for the next counseling session, I'll dart them before that. And you do see then the stress levels, they change.
Oh, that's interesting. And for severe, again, based on what you have seen in your experience as far as work is concerned, I'm trying to ask how bad can it get, but yes, what is it that you have seen that you would say this is severe, not mild?
With severe, so we've had one or two patients who have scored 0 on DART but are suicidal.
Oh no!
And so that's being picked from the clinical assessment. So the right intervention would be to do a suicide assessment and then connect them straight away with psychiatry and A&E casualty. And then the care moves from me now to inpatient casualty and psychiatric care.
I see. And Zahra, just in case someone is tuning in now and they're like, okay, holistic approach to cancer care. What is that? What are we looking at? Just briefly, and then we'll focus on the interventions.
Okay, so holistic approach or holistic care is looking at a patient or a person as a whole. So we're looking at the mind, the body, the spirit, but even the social and environmental factors that affects a person's overall well-being.
Okay. So some of the interventions that are available, I know you talked a bit about counseling, which is available, but what are some of these other holistic approaches and modalities that you look into?
So I'd introduced that in the breast cancer support group that was launched earlier this year. And the 4 modalities that we used, which was very popular, was sound healing, EFT and chair yoga, Tai Chi, and physiotherapy for pain management.
What do they look like? I know we'll have a separate conversation, especially on yoga and EFT. But say for sound, what exactly does that look like?
So sound, it's very interesting. So sound healing, and I'll try to capture it to the best of my ability.
But go for it.
Basically, the expert has different bowls with different shapes and different sizes, and then she generates a sound based on the outer layer of the bowl. And apparently that frequency or the vibration that emits from that sound is supposed to heal whoever is absorbing.
Then when you look back at the conversation that we started on the mind and body, and now say introducing sound as form of healing, what does this sound sort of like do to our brain, and so that it sort of helps promote healing? Because I know there's some people who like, ooh, sound, and differentiate that from noise. Interesting. So yes, understanding sound and putting that in mind and body, and how does that sort of like promote healing? Either could be slow, it could be fast.
I'll need to think about this.
Okay. All right. So then moving from sound, Because you said the sound, there's EFT.
There's EFT, there's chair yoga, and Tai Chi.
Okay. So, and especially Tai Chi, can we look at what that is and how that promotes healing?
So Tai Chi is a gentle version of martial arts.
Oh.
Yeah.
Really?
Yes, yeah.
Okay.
And when the patients and caregivers did it at the breast cancer support group launch, they loved it because there's that gentle aspect to it. And no one ever knew that martial arts had a softer side to it.
Now my brain is thinking, okay, like how, because you see when you think martial arts, you think
rough, aggressive.
Yes.
Yes, no, but this is a very soft side. It's independent. Once you learn the techniques, you can do it anywhere.
All right, and then we have EFT and yoga, which we'll do on the second part of this series, and that is holistic approach to cancer care. So then one would ask, then normally how long are the sessions? And we talked about who qualifies and who does not. But really, how long are the sessions offered? How many days, say, in a week?
For DART or okay, so DART, it takes less than 10 minutes to complete. You just go through a couple of questions, but generally it takes a little bit longer, especially for newly diagnosed patients because they're very distressed. So typically you'll see it go about 45 minutes, but that's for the clinical assessment and the screening. Counseling sessions, the pro bonos are 30 minutes each, but then a paid session will be 60 minutes at a subsidized rate. And DART is whenever they come in to clinic is when they receive DART.
And then you said, so this approach to say cancer care, it's complementing the conventional mode of treatment. It's not like we're saying stop chemotherapy, stop radiotherapy, or stop surgery. It's complementing. So then do you sort of like assess a person's like where they are at, say, after treatment, during treatment, at what point then do we introduce this, or is it just as they continue with the treatment?
So right now we are darting any new patient that comes in, simply because it's just 2 of us that's running the DART program, and there's over 1,000 patients in the department. So for now we're doing new consults, initial consults, but then DART is also in other studies where we'll follow them up, like the brain resilience study. We follow them from baseline up until the 12-month peak.
And then do you also psychosocial, right? Do you also incorporate family members? Because again, these are the people who have family members who want to take care of them, right? So do you also involve them?
We do, but separately. Simply because a lot of patients mention about caregiver burden. So we notice patients, the stress levels are contributed or are a result because of caregiver burden. And so we do offer DART and counseling services to caregivers, family members, but separately from the patient, just so that each person has the freedom to discuss what it is they truly are feeling, and that way we can provide them with accurate care.
And how then does that contribute to like holistic healing? I'm careful about the healing part, but yes, right? Because there's this approach where there's the conventional treatment, and then there's holistic care, and then you bring in a family member when it comes to like counseling and all those things. How would you say that contributes to just general well-being of this patient and even helping them in recovery?
So remember, holistic care is looking at the overall well-being of this patient. And so because we're a collectivistic community, Kenyans' well-being depends on the people around them, their loved ones. So it is essential to include them in their care. And that way, both are receiving accurate care and both are healing simultaneously. Because remember, they're also hurting. Their loved one has been diagnosed with cancer. There's the pain and suffering. There's all these side effects that a loved one has to see the person go through. And so we overlook them in general, but we're working on changing that.
Yeah, and I know you talked about breast cancer because that is what is happening at the moment. But are there plans to also expand to say other different types of cancers?
Yes. So we started with breast cancer because over 40% of our population are breast cancer patients, and a lot of the women from the DART screening would mention that their loved ones have walked away, partners have walked away because they've had a mastectomy or the treatment lowers their sex drive. So a lot of the times you'll see family members walk away, and a lot of the women wanted a platform where they can share similar experiences or be with people that have walked a similar journey. And that's why we established the breast cancer support group. But yes, the goal is eventually to expand and support other cancers as well.
Yeah. And kids, can we just focus on kids as well? Are they candidates, say, for holistic approach?
If they're above 18.
Above
yes,
18.
Yeah.
Okay. All right. And then looking at its long term, where would you say is the goal as far as holistic, approach to cancer care? What is the goal that you have in mind? Because like we said when we started the show, it's a fairly new approach. Not so many people know about it. But yes, from where you sit and from your department, what is the ultimate goal, as far as this, I want to say, new concepts being introduced here?
I really hope that one day we can talk freely about our mental health and what we're going through and how it's being affected, or even just openly talking about cancer and seeking the right care. And like as my director says, Professor Mansour Saleh, we combat that using care, compassion, and community. And that instills hope in people. And so that's my goal for the future.
Yeah, I like that. And for the person who's like, okay, sounds interesting, something that is, it's something to think about, or other people who are still, I'm not so sure, what is that you'd want to tell them and just tell the overall population as far as holistic approach to cancer care is concerned? That is your camera, and I'll take that as your passing shot. Yeah.
Holistic interventions work. There's lots of research and evidence-based approaches that validate that this works. And we see that in the breast cancer support group. We started with 150 participants, and today we have over 300 participants. And they show up because of these interventions that they're exposed to during the workshops. So again, we're not asking you to pick one from the other. The conventional side, so the chemo, the surgeries, that works with the disease, we're fixing the disease. But the psychosocial and the holistic side works on helping you experience your journey in a better way and improving your quality of life.
Yeah. I really like that. Thanks, Zahra. Zahra Haj is the lead psycho-oncologist as well as a clinical psychologist right here at Aga Khan University Hospital in Nairobi. Thank you so much.
Thank you for
very
having
beautiful
me.
insights that we've had today. And like you said, you're not telling people discard one and choose this. It works together.
Yes.
Because we're focusing on you as a whole person. So thank you. Thank you
so
for
much
that.
for having me.
Right. And of course, time now for you to take a look at this health tip.
Today's health tip, we focus on myths and conceptions about breastfeeding. So most mothers might believe that colostrum is dirty and should not be given to infant. That is not true. Colostrum is a very good meal for the baby. It contains all the nutrients that is required for the baby. So we should all encourage our mothers to take colostrum. The other thing is that breastfeeding makes the breast to sag. So it's not only the breastfeeding that can make the breast to sag. So there are so many factors, including the age, also weight loss. So breastfeeding alone cannot cause breast to sag. The other one is that women are not supposed to breastfeed when they are on their menses. No, menses does not contaminate with the breast milk. So we should breastfeed whenever we also have the menses.
Well, great insights we had today on Health Diary as far as holistic approach to cancer care is concerned. And the takeaway message is it doesn't mean you discard the conventional way of treatment and focus purely on holistic, okay? They complement one another. But if you have more questions, our social media handles are down at the bottom of your screen. My name is Winnie Lubembe. Thank you so much for watching, and a special thanks to the Aga Khan University for hosting us today. Until next Sunday, adios.